Hello, welcome, and thank you for being a part of WorkSafe's Treatment Pathways Mental Injury webinar. My name is Cameron Ling, and I'll be your host for this session. This afternoon, we are exploring the following key topics: how the right treatment at the right time makes a difference, the various pathways for mental health treatment, and the important role employers need to play. Today, I'm lucky enough to be joined by mental health and return to work WorkSafe Victoria experts, Nabil Nizam, Manager Return to Work. Good afternoon, Nabil.
Afternoon, Cameron. Afternoon, everyone.
Great to have you with us. Also joining Nabil is Joe Else, Clinical Panelist and Registered Psychologist. Hi, Joe.
Afternoon, Cameron. Afternoon, everyone.
Thanks for joining us. Also joining us is Kate Higgins, Manager Recovery and Performance. Good afternoon, Kate.
Afternoon, Cameron. Hi, everyone.
Thank you to all three of you for being with us today. We will take audience questions in a little bit, but please feel free to start entering your questions at any stage via the Q&A chat box, and we will get to them a little bit later on. Nabil, I'd love to start with you. As Manager of Return to Work at WorkSafe Victoria, what are the current statistics around return to work after a mental injury telling us?
Thanks, Cameron. Mental injury claims continue to increase across the scheme, as is the case nationally. We've seen an increase in mental injury claims by about 17% compared to a 6% increase in physical injury claims for the same period. So when you look at the mental injury spend on those claims, we've seen a 19% increase on mental injury claims compared to about 9% increase in physical injury claims. So the ongoing increase in the volume of mental injury claims does obviously increase the costs paid on a claim. When we look at return to work, one of the common things that we assess is how quickly an injured worker gets back to work within certain milestones. And one of those milestones is 16 weeks from claim lodgement. Now, the 16 weeks return to work results show only 36% of our injured workers who lodged a claim returned to work during that stipulated period. In comparison, the physical injury claims have performed at 65%, so double that. So definitely there's a lot of room for improvement when it comes to back at work performance mental injury claims.
Nabil, can I stay with you? What do employers need to understand about mental injury in the workplace?
Sure. I think it's important to recognize that mental injury claims are complex and they perform differently to physical claims at an individual level. Things like psychosocial risks and barriers related to a claim can be varied, therefore making return to work planning quite complicated. So it's important to recognize that. I think that's the first step in terms of supporting an injured worker. It's also important to understand when and how to support an injured worker. We'll discuss that throughout this session. And most employers want to support staff to access treatment, but really don't know, where to go and what supports to provide to a worker. Essentially, we all know that everyone benefits from staff recovery, but today's session will talk a bit more around specifically the right care at the right time, which really goes to the heart of supporting an injured worker with a mental injury claim.
Well, on that theme, Joe, can you elaborate on the term right care at the right time?
Sure. So right care at the right time is really about recognising individual differences and that there can be differences in the type and timing of treatment that could benefit someone who's experiencing distress. It's about putting the person at the centre of their care and taking a tailored approach rather than a one-size-fits-all approach. The way we respond to challenges and cope with change is informed by lots of factors, including things like our past experience, our personality, the support we have around us, and the skills and strategies that we might ordinarily utilise. And these might be different and are different for everyone. So if we consider a group of individuals in a workplace who are all exposed to the same potentially traumatic event, everyone in that group might cope with that same situation very differently. We might see some people who draw on their existing supports and it's enough for them to cope being around their supportive colleagues, normalizing how they're feeling and talking through things, and they can bounce back pretty quickly. But for other people in that same group and same event, it might be that event is completely overwhelming and destabilizing and leads to a cascade of changes that means that they might need some extra support to help them get through. Recognising individual differences and providing the right care at the right time is an example of taking a biopsychosocial approach. And what that means is that we're looking at the biological, the psychological, and the social factors that are influencing someone's health. So again, if we consider a group of individuals, within that group, there might be people who are already managing a chronic medical condition, who are caring for children with additional needs or elderly relatives, who might be experiencing a relationship breakdown or even having financial stress. And all of those things are already going to be providing a level of strain for that person and taxing their existing resources, and mean that anything additional might make it difficult for them to cope and indicate they might need a little bit more extra help to get them through. When we're considering whether someone might benefit from mental health treatment, we're generally looking for changes in their emotions, in their behaviours and in their functioning, and that these things cause a level of distress or mean that the person isn't able to do the things that they would ordinarily be able to do in all aspects of their life, and that these things have persisted for a period of time. Some examples of this might be people who are ordinarily very social and outgoing and talkative becoming less so, becoming withdrawn or even irritable. People finding it difficult to do aspects of their job that they might ordinarily be really good at, finding it hard to do public speaking or presenting when you're experiencing a lot of anxiety or panic, or having difficulty with multitasking or being on time. Or even not being able to do things that you would ordinarily be able to do to help you cope, like participate in sport or social events if you have a physical injury, for example. So you can see that by taking this approach and thinking about providing the right care at the right time, we're thinking about when it's ideal to provide care, and also the type of care that might be most beneficial for that individual.
So what types of care are available to someone with a mental injury?
Well, Kate will talk more specifically about the different types of treatment, but broadly speaking, mental health treatment really covers the full spectrum of interventions, ranging from low-intensity interventions like self-help resources and digital tools, more specialist and clinical treatments like counselling, psychology, psychiatry, and all the way up to inpatient and hospital treatments and psychosocial disability supports. Right care at the right time and taking a biopsychosocial approach means that people are offered care that meets their needs and preferences at the appropriate time, and that can change over time. For example, someone might start by exploring some digital resources, downloading an app, doing some breathing or engaging in some meditation. But if we're finding that that's not helping with their symptoms, or in fact their condition's getting worse, that would be the indicator that we might need to step up the care and look to a more clinical type of treatment.
Well, Kate, if I could come to you now, you're responsible for the quality of health and treatment services provided to injured workers under the WorkCover scheme. Are some treatments or services more appropriate than others?
Thanks, Cameron. As Joe pointed out, the most important thing to take note of is that we're matching care to the person and what is appropriate for their needs. So there are a range of mental health services and supports available in our community, but it can be hard to know where to start to find them and how to access them. Most people will be familiar with, say, going to your GP, which is a really great starting point, because the GP will look and assess what's going on for you holistically and make some recommendations. And people would also be familiar with the type of treatment and support a psychologist and a psychiatrist may provide as well. But people are less familiar with some of the other type of mental health supports available in our community. For example, we have some great supports available through mental health social work and social workers, as well as other support through counselling, as Joe mentioned previously, and our community-based psychosocial support services as well. So those services will really look to support someone again in a holistic way, come together and look at what's actually impacting on the person and their recovery. They'll look at various things like, is the person having any financial difficulty, stress in the relationship, drug and alcohol issues may be arising for a person. And as mentioned before, they might be actually quite socially isolated and becoming disconnected from their community or experiencing housing and homelessness. So all of those things can compound in a person's life and be really overwhelming and affect actually someone engaging well in treatment. So these type of social work, counselling or psychosocial type services are really going to support someone about where they're at and also help them to access psychological support. We know there's a lot of pressure on the workplace, on the mental health sector, and that means there can be long wait times to actually access psychology and psychiatry. So those services can be really helpful for people while they're waiting to engage with that important clinical support. We also know physical health support is very important, and our allied health providers can look to support someone around their diet and their sleep. There are specialist trauma-based services available in the community. So, for example, someone who may be experiencing symptoms of PTSD may benefit from these specialist programs like EDMR, or have a group-based program where they're actually coming together to learn about the impacts of trauma and gain that shared lived experience in that peer setting, which many people find extremely beneficial. I think it's really important to note that for all of those services, there is a no wrong door policy. So if you're unsure about if this is the appropriate service at this point in time, all of those services should be supporting the person to identify that. And if not appropriate for them to provide that service, make sure that they're guiding people on their recovery journey and pointing them to the appropriate service and support.
Thanks for that, Kate. What are some of the types of barriers injured workers can face when accessing treatments?
I think one of the biggest barriers is stigma. So whilst we've come a long way as a community to understand and accept mental health, and many of us are impacted by mental health, either ourselves or within our community, there's still a degree of shame and blame in terms of accessing mental health treatment and supports. And if there's one thing we can do as employers, as friends, colleagues, families, community members, is to really normalise that help-seeking behaviour, because it's really important for people to access treatment and support as early as possible as they're experiencing challenges, because we know that really helps people on their recovery journey. So that's one of the most important things to remember. The other barrier people can face is perhaps they've had a poor experience with a provider before, and that may be for various reasons. They might not have been in the right place to receive that treatment or support, or it might not have been the best quality support and it's not been the right fit for them. It's important that we don't give up and just walk away from that treatment or support. And as I mentioned before, reach out, go to someone that you do trust, potentially your GP or others, and re-look at your recovery and find the right treatment group and support people around you. One of the other barriers we know is, as I mentioned before, pressures on the mental health workforce and therefore long delays to access treatment, particularly for those living in more rural and remote areas. So it's really important that we look at other ways to access mental health support. And as Joe mentioned before, there's some really great resources online, there's some really great digital tools, and telehealth has become more commonplace to be able to access those important mental health supports as well.
Joe, can you confirm what is the employer's role in the treatment of mental injury?
Sure. So on a primary level, employers are well placed to recognise the changes in someone's functioning that I mentioned earlier, purely by effect of the amount of time that we spend at work. By noticing changes and recognising that someone's having difficulty coping, it supports early identification and early intervention, and therefore accessing the right care at the right time. Employers can educate themselves about the range of treatments that Kate has mentioned earlier, and in turn provide that information to people in a workplace who might not otherwise be aware. That might be information about the types of treatment that are available, it might be about the processes for accessing treatment, or it might be information about entitlements that someone might have as part of their mental injury claim. I would encourage employers that quite often this is more than one discussion. It might start with a single discussion and coming up with some agreed actions, and then following up with the person periodically, step by step on their recovery journey. when you're supporting someone with a mental injury in the workplace, I'd really encourage employers to consider that returning to work is part of the overall treatment picture. And this could be part of a return to work program, where a gradual return to work really provides an opportunity for people to put into practice the skills and strategies that we might be working on in a treatment setting. And that really is quite invaluable in terms of overall recovery. So where possible, if employers can approach that and see that as part of treatment, be understanding, be flexible and be supportive, that can be really, really helpful. And one final point is that employers play a really pivotal role in the prevention of mental injury through developing a mentally healthy workplace culture where mental health is spoken about, where accessing treatment, as Kate mentioned, is normalised and supported, and where those who do have a mental injury are supported back to workplace in their recovery and return to work, and that's part of business as usual.
Kate, if I could come back to you, do you have any examples of right care at the right time from your experience that you could share with us today?
Yeah, I do, Cameron. So I'm going to talk about John. John was a 49-year-old plasterer and unfortunately fell from a fairly significant height, 3 meters, due to scaffolding issues, and suffered quite a significant injury to his left arm and had carpal tunnel syndrome as well. So following that injury, John was unable to work for a period of time, and from there things started to spiral for him. So he actually had difficulty with his housing and ended up, unfortunately, experiencing homelessness, so couch surfing and sleeping in his car. There was some drug and alcohol dependence issues. There was real isolation, and unfortunately, John began to actually experience some suicidal thoughts and ideation as well. So John was really losing hope. Everyone wanted to support John that was there for him and had referred him to your typical psychological support. But John was distrustful and disengaged and feeling really hopeless and couldn't get himself to those appointments. So what they did was actually refer John to the outreach community mental health services that I mentioned before. And that meant that someone could proactively follow up and meet John where he was at, go out into the community to find John and sit with him and really understand what was happening for John. When coming up with a plan about what was most important for him in terms of his recovery, John pointed out that surgery was at the top of his list to actually address some of the pain that he was experiencing. But some of the challenge was that a hospital wouldn't actually go ahead with the surgery unless John actually had his housing and accommodation sorted so that they could have a confident sort of transition out of hospital plan. So the outreach worker really focused on short-term accommodation for John so that he could then get that surgery in place. Once that happened, John was in feeling better, was experiencing less pain, and was able to then think about the wider issues impacting on him in terms of his mental health supports. So the outreach worker then was able to really engage John in seeing a psychologist, finally getting some drug and alcohol support. And then following that moved to supporting him with long-term housing. So now John is actually relocated to country Victoria, has a 3-bedroom home, and he's just getting life back on track and engaging in his hobbies and retraining and looking at other employment options for him. So I think from that example, you can see that in terms of right care at the right time, it's not always linear, and that we really need to look at the person and their current circumstances and think about, okay, what do we need to put in place in terms of stepping stones to get someone back on their recovery journey?
Kate, really appreciate you sharing that one with us today. Some really important messages from that one. Nabil, if I could come to you now, are there any common misunderstandings people may have in mental injury treatment pathways and return to work?
I think Kate touched on this really well, and Joe throughout the session as well. And I think the main thing, Cameron, is that there's no one-size-fits-all model when it comes to mental injury management. So you'll see typically an employer might have a really good early intervention program, which is something that we talked about yesterday. And the expectation is that an employee will need to go through that program and come out the other way recovered. But in reality, you do need to provide that tailored support and person-centered planning and biopsychosocial assessments and things like that. So whilst you have a really good program within an employer, it's really important to recognize the worker for the issues that they're going through, and then supporting them, throughout that journey of recovery. Another common misunderstanding is that the perception that non-clinical services just fill a gap while waiting for proper clinical treatment. In our view, in terms of claims management and return to work, it's the first bits that the employer does around acknowledging the issues when they're raised and supporting the worker through resolving those issues and providing that overarching psychosocial risk management initiatives will go a long way, as sometimes as much as clinical treatment do. So these are two really important things. So, and the last one I think is the misunderstanding that you must wait until your claim is accepted to access treatment. Again, we talked a bit about this yesterday, and that's that the WorkSafe scheme does have provisional payments. So where a claim's rejected or pended for investigation, workers may be entitled to provisional payments through which that they can access psychological treatment. So understanding these are really important, and it'll be pivotal in supporting the worker. And I guess the last bit again is the point about stigma, which Kate covered really well. It's a very big issue. Employers do a lot in terms of addressing the issue of stigma, but ultimately what we do at an individual level when it comes to mental injury claims, supporting them, acknowledging their issue, helping them lodge the claim and supporting them through the claims management and return to work process. These things go a long way in terms of achieving that early return to work and the sustainable return to work that we're all striving for.
Great. Thanks for that, Nabil. I'd love to get to the questions now. A lot of questions coming through from our audience. You can continue to enter questions into the Q&A chat box, and I'll attempt to get to as many as I possibly can. I will also attempt to try and steer them in the best direction between the three of you, but please jump in if you've got anything more to add. This first one, a lot of people wanting the answer to, from Jeff's question. Provisional payments provided for 13 weeks, irrespective of whether the claim is accepted. However, it's hard to get into a psychologist or psychiatrist. A number of treaters refuse to do work cover claims. Can WorkSafe resolve these issues, as early treatment is essential to enable recovery? Nabil, do I steer that one to your direction first?
Sure. I think the issue of lack of GPs or lack of treaters is something that we covered earlier on. This is an issue that WorkSafe would, I guess, try to address as much as possible. It's a tough one because I think this is one of those things where it really comes down to on a case-by-case basis. Where there's an issue of a payment delay and therefore a provider has refused to service a work cover claimant, I think WorkSafe will look at it on an individual case-by-case basis. But outside of that, on a trends level, I think it's something that WorkSafe will have to continue working on to support the claimants access to treatment.
I can add to that too. I think, as I mentioned before, there's a number of other services. So while there are certainly pressures on psychology and psychiatry, we have access to social work, we have access to other psychosocial community providers and counsellors too, who do have greater availability. So I'd really encourage people to consider to learn about those services and consider referrals also to those programs who very much can step in as early as possible to support people's mental health recovery.
I might also add one final point to that picture, just in terms of Kate's point earlier around there being no wrong door policy. And sometimes in this circumstance, it is a matter of perhaps wanting to get into the preferred or the first provider that has been mentioned to you, but going around, ringing around, trying different practices, trying different practitioners. A really good practical tool that I often recommend is also asking to be put on wait lists or cancellation lists at multiple places if you need to, just so that as soon as an appointment becomes available, you get that phone call, and we've got lots of different pathways open so that people can access treatment as quickly as possible.
It's great advice. Joe, I might stay with you on this one because the next question, a few people wanting the answer to, relates to what you're talking about there. It is more of a statement I'm about to say, but just keen for your response. The biggest problem with accessing psychological services is the time frame to see treaters. It would be beneficial if insurers had a list of treaters that deal with work cover clients. Are you able to respond to this?
Yeah, I've got a couple of thoughts on that. Look, most of the insurers that I work with in my work with the clinical panel quite often will be able to provide a list of WorkSafe registered providers to injured workers. And I believe that you can actually search sites like the Australian Psychological Society and filter by psychologists who see WorkSafe registered practitioners. But certainly I would encourage any injured workers who are having difficulty finding a psychologist in particular who sees WorkSafe clients to liaise with their agent and ask them. Usually we can provide a listing or a tool where you can look for psychologists who do see WorkSafe workers.
Yeah, I can't just second that. We've been meeting with a lot of the actual psychology peak bodies to really work on a solution for this, because we do recognise that would be a very helpful tool. And obviously we have to work through how we set that up in terms of working with, like, say, provider searches through those peak bodies as well. And a lot of the psychologists obviously service people from other funding bodies as well. So how do we streamline that and make that as helpful tool as possible to the market?
Kate, I might stay with you on this question, but please jump in, Nabil or Joe. How can the employer support employees who are overworking themselves and look to be headed towards burnout plus a potential mental injury, especially when they are resistant to accepting assistance, relinquishing control of projects, or handing off responsibility for tasks?
Yeah, that's a great question. Look, I really do think it's important for employers to have honest, transparent conversations with their staff about what they're observing in terms of the impact on the person's mental health. I think we all probably are familiar with individuals who really do struggle to hand over work and are very passionate about their work and have a strong work ethic. But ultimately, it's that working with someone to recognise that work-life balance is incredibly important, and we can't hold all of that. And ultimately, if that's the detriment to their own health, that will have an impact on the work that they're so passionate about. So it's really important to have open, transparent conversations with people about what you might be observing. Sometimes employers might implement sort of well-being plans, which some people can find very helpful. And in that, you can proactively identify where there are signs that perhaps things aren't going well for the person, or they might need to make some changes, and really encourage working collaboratively as a team and all recognising and supporting each other's mental health.
I'll just add to that as well, Cameron. I think it's important for employers to ensure that burnout's a big issue, and it's important for employers to ensure that there are enough controls are in place to address this psychosocial risk. And those controls are individualized to the particular employee and more broadly for that particular position description for that particular team. That goes to, I guess, the crux of the prevention aspect of this issue, right? And then secondly is the element of the employee being open and honest, as Kate said, and speaking to their manager around the issues that they're going through, and then the manager working with the employee, and then bringing this back to today's topic around right care at the right time is then deriving the learnings from today's session and helping the employee go through that, whether it's counselling, whether it's debriefing, or whether it's actual treatment, that goes through that entire line from prevention to injury management in the workplace.
Great, thanks for that, Nabil. Joe, I might steer this one to your direction initially, but please, again, jump in, anyone. How to manage a mental injury claim for someone who just doesn't want to return to work when the employer has done everything to provide support and return to work plans. However, they have all failed to be successful. What is the recommended next step?
Yeah, this is a challenging scenario, absolutely. Look, I guess as I said earlier, everyone is different and everyone is going to have various factors that are contributing to how they cope with or don't cope with the situation. I guess something that I always appreciate as a treating psychologist is being included as part of the return to work and recovery planning process. So, I know sometimes it is a very challenging prospect to have your psychologist and your employer talking, but if we can try and have those conversations framed around being a collaborative effort towards supporting someone in their recovery and return to work, having a conversation with everyone there about what the barriers are to coming back to work, trying to understand why it is that a return to work plan might not be accepted, why it's not working. Often there's other background factors that we might have overlooked or might be contributing, interpersonal issues, relationship issues, some of these other psychosocial challenges that we've talked about today. So again, I think it starts with a conversation and trying to build that relationship between employers and injured workers to have that trust to be able to talk about these things and really unpack what it is that's blocking the recovery so that we can put supports in place to get past that.
And I'll just expand on that, Cameron, and obviously working with your agent in terms of having those discussions, right? So the agent might have further information that sometimes the employer may not be privy to in terms of clinical reports and medical reports and so on. And then, as Joe touched on, just asking that question repeatedly, why, what's going on? Is it work-related, non-work related? Is it a lack of confidence? Are there other biopsychosocial factors that are really stopping the worker from participating even in planning for return to work, right? So again, it goes back to that asking the question why repeatedly to identify and get to the core of the problem. Ultimately, if we are confident, and that is with the agent and the employer, that we are confident that we've done everything as much as possible and provided that support reasonably well, then obviously we do have the non-compliance element when it comes to return to work under the legislation that the agent will support the employer through as well. But again, we always try to support the worker in terms of the return to work process prior to the non-compliance or triggering the non-compliance aspect of it.
And I'd probably just add one more thing as well, is that how important the role of the health provider is in those conversations to support someone in their return to work. So it's really important that health providers are following the clinical framework and having a really good understanding that return to work is fundamental to people's recovery. We have much better recovery rates if people are returning to work as soon as possible into the right environment, obviously, rather than holding back. So a lot of the best recovery outcomes are when we're able to get back into work and be around our colleagues and have that routine and structure back in our lives again.
Kate, I'm going to stay with you on this one because I think it was you who mentioned something about this before, but just a clarification here. Is it appropriate to access mental health support via telehealth?
Yeah, absolutely. Telehealth has been a really fantastic thing for mental health treatment and support in particular. It's provided access to a lot of people who may not have had that type of access to physical sites, particularly if they're isolated in rural areas. I do know a lot of providers would say that sometimes best practice is to ensure some degree of face-to-face connection, because it really does depend on the person's preference. Some people might feel a little more uncomfortable using technology and may need the support to actually set that up in a way that feels comfortable for them in a really confidential space, for example. So having access to that confidential space at home is really important consideration when you are accessing mental health telehealth support. Yes, so there are a range of things to consider, but telehealth is absolutely appropriate mode of receiving mental health treatment and support now.
Great, thanks for that, Kate. Nabil, I might come to you on this one. When mental injury claims are accepted, WorkSafe in most cases only pay a scheduled fee. Some doctors charge significantly more than the fee paid, and some workers miss out on treatment. How can this be resolved?
That's a tough one. So, unfortunately, WorkSafe have a set of schedule fee that's where sort of we need to abide by, or the agents need to abide by. I think there are other providers that might be able to support and service injured workers in line with the schedule fee. So, one option may be to speak to your GP around seeing if they know anyone who services injured workers under the WorkSafe scheme and adhere to a schedule fee. There may be options or in terms of paying above the schedule fee, but the discretion is up to the agent and depending on the circumstance. But by and large, I'd say to speak to to your GP and see if they can refer them back to a treater who can pay under the schedule fee.
Great,
I
thank
might
you.
also add to that, just in terms of, I can only speak to psychology, but I'd encourage injured workers to contact and have a discussion with clinics or with psychologists just about the fees that they are advertising. Sometimes the rate that is charged for private clients is, we can negotiate that fee. So I think have the conversation and let your provider know that you have an accepted claim, and it may be that a lower fee or the scheduled fee can be negotiated.
Next question here. I'm going to open it up to all three of you because I don't know specifically where to direct it, and I may need some help with the acronym initially. EAP is recommended for early intervention re mental health issues. It is free and confidential. Can do phone counselling initially. Why not plug this?
I'll jump in there. Absolutely. EAP is a wonderful service that's available, a really important early intervention step. So yeah, we didn't obviously want to intentionally leave that out. As I mentioned, there's such a range of mental health treatments and supports available, and EAP is a really important one service available to people. So it's a very good question and a very good call out. Thank you.
Great, thank you for that, Kate. That's great to clarify that one. Joe, I might send this one to your way. Given that we do not always connect with our treaters and the treater may have differing specialties, how can the employer assist a worker get the right care at the right time?
Sure. Look, it's absolutely a very common thing that happens. There's not necessarily always a great fit with the first provider that you might link with. So I think it's really about, as I mentioned earlier, having conversations with your injured worker, getting feedback from them about how they're feeling about the treatment. And if it is, the feedback you're getting is that the fit's not right, or they're not feeling it with the provider, providing that education about there's no wrong door. You can always go back, get a new referral, or try linking with a different provider. I'd always recommend to people that they talk with the provider as well. If there's something that's happening in the therapy or in the treatment that they're finding uncomfortable or that isn't working for them, it might be something that can be addressed. But otherwise, from an employer perspective, just encouraging the injured person that it's not a fixed model. You don't have to stay in the first treatment that the first provider that you link with. And it's always possible to go back and try finding someone else who's going to better fit your needs at that time.
Great, thank you. This next one I might send to you, Nabil. On many occasions, we get a psych report / feedback from the GP / psych saying the injured worker cannot return to work for the next 3 months. This is usually in the first 6 months of the claim. How do we ensure, as employers, treaters are following the clinical framework and encouraging return to work?
I think it's in that case, the primary, I guess the first point would be to speak to the GP or the treater to understand why that 3 months restrictions in place. That would be the first port of call, and then you'll be able to unpack a lot of things there. Again, work with your agent and the case manager to understand what else they have in place or within them that provides a bit more information around the restrictions. For example, it may be a case of the worker's lack of confidence, or the worker needs some time off in terms of recovery and rest right? And then there might be other non-clinical related matters that the worker is going through. So it's about understanding that with conversations with the treater and the case manager, and then asking those questions. We do have options of GP case conferences where parties can sit together and talk about the worker's condition and return to work and so on. There's probably another option around proposing various different return to work options. A GP might not really know what other jobs are available for the worker to go back to. They might assume that the pre-injury duties are the only duties the worker can go to, and therefore the restrictions are based on that. If a proactive return to work arrangement with some appropriate suitable duties, light duties, is offered, that's providing the GP with additional information to sort of reassess the worker's condition and see whether they may have the capacity to undertake new duties. So overall, I think there are a few options in terms of discussing with the case manager, discussing with GPs. There are services available within the scheme, and the case manager will be a great point to start.
Probably just add to that as well, the role of our clinical panel. So we have a fantastic group of specialist health professionals on our clinical panel, and they play a really important role for that treater to treater contact. So what they may do is actually reach out to a treater and spend some time and have a conversation about what's driving that treater to make those decisions and provide some guidance and advice, particularly for those that maybe not be as familiar with working under the workers' comp scheme. So it's a really important service that's available, and Joe is one of those wonderful clinical panelists. And we also have a clinical support hotline as well. So providers can actually ring through, schedule an appointment with our clinical panel and talk through any questions or seek guidance and advice. And it's a really important service, and I encourage providers to actively use that.
I'd find that just one final point on top of that, Kate, just in terms of the question around ensuring that providers are working within the clinical framework. Absolutely, the role of the clinical panel is to build those relationships with treaters in the community and ensure that providers are supported to work in line with the clinical framework. Our psychology policy has a great new treatment planning form that providers are requested to complete within the first couple of sessions of their treatment, that really is thinking about how we're setting up our treatment planning for the best outcomes, and with those goals in mind around the clinical framework.
Thanks for that, Joe. If I could just sneak this last question in really quickly. Where is the best place to source local services for workers? Who's best to answer that?
I'll jump in to start with, and the others can add. GP is a really important first point of contact, who should be aware of the local mental health services. Online services can be really helpful too. So I do a plug here for Beyond Blue and some of their resources. The state government are also working on establishing quite a number of local wellbeing and mental health hubs or local services, and they're going to be a one-stop shop where people can walk in and actually receive some advice and assessment and access some treatment and support as well. So it's really important to understand what's available to you locally. So I'd really encourage people to go through some of those access points as well. And as I mentioned before, it should be a no wrong door policy. So whichever service you reach out to in your local community should be able to steer you in the right direction to appropriate treatment and support for yourself.
Great. Thank you so much. I am conscious of time. I'm going to have to finish up. Sorry to those people who have asked questions and I didn't get a chance to get to them. We really appreciate all of our audience engaging so well and so many great questions. I'm sorry I can't get to your question. A huge thank you to our panel, Joe Else, Kate Higgins and Nabil Nizam. Joe, thank you so much for your time.
You're very welcome. Thanks for having me.
And thank you, Kate. Really appreciate you joining us today.
No worries, Cam. Thank you.
And Nabil, finally to you, thank you so much for sharing with us today.
Thanks, Cameron. Thanks, everyone.
It's great to have the three of you sharing your insights today, explaining the range of services that are available to people with a mental injury to help get them back to work. We hope that everybody has found this an interesting and informative webinar. This session will be available on WorkSafe's website in the coming weeks, so keep an eye out for that one. We certainly value your opinion on our Health and Safety Month events. Shortly, we will be sending you out an online survey. We would love it if you could provide your feedback so that we can incorporate your suggestions in our program next year. All respondents will go into a draw to win one of 5 $100 gift cards. Shortly, we will show on screen a list of all the contacts or programs that we have covered in today's session. If you have any requests for further information, we do recommend you to please get in touch. If there is something you want to discuss, there is the WorkSafe advisory line, which is open 7:30 a.m. until 6:30 p.m. Monday to Friday, or there's also the emergency line, which is open 24 hours a day, 7 days a week. Thank you so much for being part of what is our final webinar for Health and Safety Month 2024. We appreciate everybody who's engaged in all the webinars and all the events across the month. Thank you and stay safe.